Good morning. Our journey with the rare disease community began far before we ever knew it existed. We were living on the Central Coast in California. My husband and I were a busy young family. We were working full time, and we had a busy and active toddler at home. In the fall of 2017, we found out we were expecting. We went to our 20-week appointment to find out whether we were having a boy or a girl. We left that appointment being told, in no uncertain terms, you have a week to decide if you'd like to terminate the pregnancy. That appointment changed our lives forever. All because of a single measurement that could potentially be serious and have extreme conditions. My life after that became a series of follow-up ultrasounds, echocardiograms, and testing, none of which produced any positive results. Olivia Josephine Adair was born on July 7, 2018. She was bloated, never cried, and was breathing but not well. They pulled her from me immediately and began working on her. It would be 4 hours until I got to see her face. It would be another 3 days before I got to hold her. That week for me will always be one of the most difficult in my life. She would spend a week in the NICU. 2 days after she was born, I was discharged from the hospital. I thought for sure they won't send me home without her, but they did. It was as if somebody had carved a hole out of my chest. A part of me was missing. But a week later, she came home. They pulled the monitors and tubes from her, and life more or less returned to normal. She slept a lot. That first year, I think that's all she did was sleep. I had to wake her often to feed, and even then she didn't feed very well. I returned to work in October. It wasn't until her 6-month appointment that her pediatrician, Dr. Hutchison, became increasingly concerned about her. She had missed several milestones at this point, and she had been hospitalized several times with respiratory illnesses. I always like to tell people she was either healthy or hospitalized. There was no in between. I will always give her pediatrician, Dr. Hutchison, so much credit for the role she played early on in Olivia's life. My husband and I were exhausted. We had been through multiple tests since that 20-week appointment. Each test was a breath of anticipation in and a sigh of disappointment out. We had no results. And frankly, I was tired of looking for something we may never find. But Dr. Hutchison looked my husband and I in the face and gently yet firmly said, "Please do me this one favor. Please go to the neurology and see what she has to say. If nothing comes of it, we'll let it rest." So we went to neurology. Of course, it only took us 6 months to get in. I think the neurologist spent all of 5 minutes looking at Olivia. She looked at her belly, her back, her arms and her legs and her toes, and she said, "Well, there's nothing I can do for you. You're going to have to go to genetics." So we went to genetics. In July, we went up to Stanford University and met with the genetics team. Of course, they ran their own tests, but it would be multiple weeks until we got our results. A few weeks after that appointment, I woke up with some interesting symptoms. My skin felt like it was on fire. My limbs were so stiff, I couldn't move. And I had nausea so bad, I couldn't eat. Very quickly after that, I only can explain it as being the deepest, darkest depression I have ever known in my life. I spent the majority of most days laying in bed or on our couch, sobbing. I was so unhappy, but I had no idea why. I had 2 beautiful daughters at home, a husband who loved me, and a wonderful career. Yet I was so unhappy. Funny thing happened, though. About a week later, we got a phone call. It was Stanford University. We had our results. Olivia was patient number 55 of a rare genetic condition called USP7. It was so new, they didn't even have a real name for it at the time. She is now one of 135 patients with what has just now been named Howe-Fountain syndrome. If the search for a diagnosis broke me, her diagnosis saved my life. It validated everything we had gone through leading up until that point, since that 20-week appointment. My husband and I began to process everything we had been through. For so long, we had been surviving. If it had been just one hospital stay, just one test, just one NICU stay, we probably could have gotten through it. But it was hit after hit after hit that really did a number on my mental and emotional well-being. So while we had time to process everything we had been through, we also had to start processing what Olivia's life was going to look like now that we had a diagnosis. She wasn't going to be the same child we had envisioned her to be. We had to, in a way, grieve the person she wasn't going to grow up to be. A few weeks later, we made the difficult decision, my husband and I, for me to quit my job. And about 6 months later, we made an even bigger decision. We decided to move our family across the country to Charlotte, North Carolina. Living on the Central Coast in California, we did not have access to the health care that we were going to need. We lived in a rural area, and while it was beautiful, there were not the opportunities and choices we wanted for our daughter in her therapies and in her specialists. I have been through a lot these last couple years. My family has been through a lot. And it has taken me several years to get back to who I think I am. It has taken many therapy sessions, some medications, and the infinite support of my family and friends. I still have to think consciously some days about my mental health and how I'm moving forward. I have to check in with me from time to time. But through all of it, my husband and I, we've become better at checking in with each other as well. I'm happy to share that Olivia is thriving today. She just started preschool this year, and as you can see, she started with a walker, and she ended the year walking on her own. When thinking on the topic, resiliency while rare, I don't believe we wake up one day and all of a sudden we're resilient. I think it's a process, and I think there are degrees of resiliency within each of us. The Maggie before Olivia arrived wasn't very resilient. I learned that pretty quickly. But we choose to be resilient in many ways. For us personally, we choose to be resilient by being grateful. I am so grateful for all of the people we have met on our journey so far, the beautiful individuals who I feel like I've known my whole life, but some I've only known for a couple months or a year. I am thankful for every specialist, every therapist we have seen who has shared stories with us, shared their words of wisdom, and especially those caregivers and specialists who have taken time out of Olivia's appointment to turn to me and say, "How are you, Mom?" That was when I knew I might not be okay, when Olivia's doctor was asking if I was okay. And on our really bad days, I'm simply thankful for the challenges we don't face, because some days they feel like a lot. We're also resilient in choosing to celebrate the milestones. I don't know if any of you are raising typically developing children alongside non-typically developing children, but there's something just a bit sweeter about the milestones reached by non-typically developing children. When our first daughter started walking at the age of 1, we were thrilled. As new parents, it was pretty cool. But when Olivia started walking on her own at the age of 3.5, I can tell you there wasn't a dry eye in the room, including her older sister, her physical therapist, and her dad who rushed home from work that day. And lastly, we're resilient by sharing our story. I will tell you, when we first got Olivia's diagnosis, I didn't want people to know. I didn't want to share our story, which is very unlike me. I tend to be an oversharer. But as a parent and a caregiver, you want nothing more than to protect your child and to save them from any potential danger or harm. I was afraid that Olivia was going to be judged, or that people would define her based on what they thought they knew. But I now know that in sharing our story, it has made us stronger as a family. Her sister took a book to school this year to share with her first grade class. She doesn't know all the details of Olivia's diagnosis, but she knows Olivia's a little different, and she was able to share with her 24 other classmates some of the struggles Olivia has gone through. In sharing our story, we're not only sharing understanding and empathy, but we're also giving Olivia a community to grow up in. We're giving her support, and we're giving us support too. While Olivia's hurdles and challenges are not over, we have certainly faced our share. She is resilient, and she has taught us to be resilient too. Thank you.